So you may have heard of a Botox brow lift or a toxin brow lift or an anti-wrinkle injection brow lift. Botox is a brand name for botulinum toxin, and it's one of the more commonly used brand names. And it can be used to sometimes lift that outer brow. So if these injections, this botulinum toxin injection, doesn't lift because botulinum toxin doesn't lift muscles, then how do you get a Botox or a botulinum toxin brow lift? And it's really important to understand the anatomy here. So you have an elevator to the brow, and that's a muscle that lifts up the brow, and that's called the frontalis muscle. And the frontalis muscle is here. And then you've got muscles that form your angry 11s. So when I go like this, these are the angry 11s that some people get that they use botulinum toxin for. And those are caused by the procerus muscle that brings down and the corrugator muscles that can bring the brow down and across here. And you've also got the orbicularis muscle that is around the eyelids, and it's partly used for your blink, but it can also, when we're angry, cause the outer brow to drop down. So when we're at rest and we're not using our muscles, there is a slight tone actually in our muscles. And so the frontalis muscle on the outer brow, if we look at this first, there's a frontalis muscle, it's having a slight tone, and the orbicularis muscle has a slight tone. So when the frontalis muscle has a slight tone, it's lifting the brow slightly up, and the orbicularis muscle is pulling slightly down. And there's a balance there, and the brow is resting at that height. So when we use injections, anti-wrinkle injections, and we put a small amount into that orbicularis muscle, that balance changes, and you can get a millimeter or two of lift to the outer brow as a result of injecting the orbicularis muscle. So although the botulinum toxin itself doesn't lift, by reducing the impact of the depressors on the brow, you then get a mild elevation. In the same way, if you do the angry 11s and you're somebody who sometimes does this expressively and brings your brows down, if you then reduce this area, then that pull down effect from those muscles in this area, the procerus and the corrugators, isn't having an impact, and the brows then look a bit more spaced out and slightly elevated medially. So that's hopefully explaining how you get a brow lift from something that actually doesn't lift.